I'm Dr. Barry, licensed psychologist, and here we talk about true crime and psychology. Thank you so much for joining. Let's hop right into today's topic. Let's go.
Welcome. Thank you all so much for joining. I am once again Dr. Barry. I am a licensed clinical psychologist, and today I'm going to be talking about the testimony of the psychiatrist from a clinical psychology perspective. I do hope that we are able to hear from Lindsay's therapist. I'm not sure if because Dr. Tufts, the psychiatrist, and then even on the inpatient unit, psychiatrists, when they're involved on the same treatment team, they often take the lead for the treatment. They often take the information that the psychologist, that the other people are giving them to apply to the medication recommendations. I would still like to see if we can hear from them. We might not. Okay. So we might not hear from them. We will see. And let me know if you all have any questions. The one thing I do want to say is that the state is attempting to get justice for the children in this case. And my heart goes out for them. And it's my goal as we talk about these things to talk about can we avoid situations like this? What information, education can we put out there so that people get support and resources sooner? There's often a lot of stigma with mental health. And if somebody is having intrusive thoughts about harming themselves or others, there is the free 988 hotline. But the 988 hotline, you're not talking with a licensed person. You're talking with a volunteer that's agreed to help provide crisis intervention. They often get training, but I would also encourage the person to have their own therapist, somebody that they can sit down on a regular basis and talk with. I have worked with individuals in that were struggling postpartum, that were struggling during pregnancy, that were struggling during menopause or perimenopause. Hormones can play a really significant role in a woman's mental health. And sometimes people have to advocate to get labs run. So, as a psychologist, if somebody's referred to me for treatment resistant depression, but they haven't run a blood panel in the last year, I like to run a blood panel just to see how's the thyroid working, because there are things that can mimic mental health conditions that are medical concerns. And I can't order labs. So, as a psychologist, I can't order, only the medical doctor can order labs. So I will often encourage my client to talk with their doctor in order to get updated labs if they haven't had labs. And sometimes it comes back that their iron is low, that their vitamin D is low. And that's not saying that there's not also a mental health condition, but medical and mental health, and I personally see mental health as health altogether. In my mind, I don't separate it because the two can really play off of one another. And when somebody is in chronic pain, when somebody is really, really struggling, and when they feel like they're doing all they can do, there can be this hopelessness that comes. And just having somebody say, I see you, I hear you, let's work together to get to the bottom of this. I've often advocated for the clients that I've worked with, if I have needed to talk with their with their prescriber, if I've needed to talk with their doctor, often I do that in a letter. Collaborating with doctors can be difficult. I know people have a lot of thoughts and feelings about not talking to every single provider. There are certain treatment centers where that is the standard, where when somebody is admitted, they do their best to reach out to every single provider they can, especially the provider that they're going to discharge the patient to, just to make sure that there's a smooth transition. I've had clients where from the inpatient unit, I've received a phone call to collaborate with the treatment team to discuss what the current issues are, what the concerns are. And I normally try to meet with the client within 24 to 48 hours of a hospital discharge. Locally, our community services board, they have to provide an appointment post hospitalization if somebody can't find a provider to do that. And for me personally, we're just talking about what might have helped in situations like this. If a client is discharged from a psychiatric hospital, our next appointment has to be in person. And if the client is out of the area, because sometimes I work with people that are more than an hour from my office, and but sometimes we evaluate, is telehealth the most is that the best form of treatment for you right now? Because doing things like monitoring severe things like thoughts of harm to self or others, we often like to do that on an in-person basis. Sometimes there are rural communities, sometimes there are communities where if that's all a person can get, I'd rather them have some care than no care. But it's my policy that if somebody is discharged from the hospital, our very next session is in person. If they're evaluated at the ER, our very next session is in person. And once again, that's me as an outpatient therapist. Um, and there are some things that hit too close to home that I can't share because I don't have multiple clients. So anytime I share something, please know that there are 10 or more clients that I've worked with that have had a particular condition. So if I ever share something, it's not something that can be narrowed down to one specific client. Uh, but the thing that popped in my mind would be too specific, and so I'm going to keep that in my mind. Some people might be wondering why all of this information or how all of this information is coming into her trial. So when Lindsay Clancy pled not guilty by reason of insanity, she signed a waiver to provide the state and the defense access to her entire file. Her former treating providers, they are not being entered as expert witnesses. So they are not being entered as an expert in the field of clinical psychiatry, adult mental health, or they're not being entered as experts. They are fact witnesses. They are not being asked to give an opinion based on whether they think Lindsay at the time of the incident, any of their thoughts at the time of that incident. They are only talking about her treatment before. I'll mention now, I would have loved Dr. Tufts. If you happen to watch this, you don't have to. I would love it if she'd wear a suit. Like I just like when people are in, and she wore like a nice white button up. That was absolutely fine. That was absolutely fine. She presents young, and I don't know that she's as young as she looks. My son was recently evaluated by a local psychologist, and I could have sworn that she had like just got out of graduate school within the last 5 years or something. But she actually graduated a year before me. And so she just looked good. And I was like, ooh, like your skin, my bad. Like I assumed she was a certain age, but she wasn't. Please also know, because I hear a lot of people talking about that Dr. Tufts hadn't been out of her residency for an extended period of time. Psychiatrists do 5 years of medical school. And then on top of that, they do a 4-year residency. And some of the best providers that I've worked with have sometimes been residents, because residents are often more up to date on the literature. They're often more like flexible with different options versus working with a psychiatrist that's kind of been doing this. Not I'm speaking very generally, okay? From my experience, sometimes the younger residents that I worked with under supervision of whoever the doctor that was supervising them, that was board certified and everything, they often just saw things in a different way. And so from everything that Dr. Tufts testified to, I didn't question her treatment. And that surprised me, because from reading Patrick Clancy's lawsuit, I was thinking, oh my gosh, like everybody dropped the ball. Like I saw everything in a very different way. And Dr. Tufts was testifying from her records. So as a medical professional, as a psychiatrist, me as a psychologist, what I write down is what matters the most. So if I have a client that I assess for safety, I have to make sure that in their note that I write down that we assessed for safety. when I meet with a client, and if they don't report any thoughts of blah, 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 I document in my note because it doesn't, I don't want to rely on my recollection. We're relying on those notes. And so Dr. Tufts did look back to her record quite a bit. I'm going to go ahead and take a look over at the chat. I have been following up over here. Do you think her insurance caused barriers to therapy? So no, she actually had a therapist that she could have worked with. I don't know if she would say that she didn't feel that therapist was a good fit. So I don't know why she didn't meet with that therapist more often. Blue Cross Blue Shield is, so I don't, sometimes in different areas, it's different. They are one of my highest payers. And so I haven't had clients with that insurance have difficulty finding care. There are some other insurance companies that sometimes clients have had more difficulty finding care, but I don't think that came into play at all. Um, all right. Are psychiatrists expected to be mind readers? No. So, psychiatrists, now, if they observe something, so if they observe a client responding to internal stimuli, so if they see signs of psychosis, if they see signs of mania, if they see a client is reporting feeling okay, but their mood is depressed and flat, a client is reporting feeling better, but they're arriving disheveled. And so there sometimes can be some other clues, but a lot of mental health treatment, even like medical treatment, you have to the person is communicating to the doctor what's going on with them. Very often with this case, people will bring up whether wondering if Lindsay Clancy didn't report all of her symptoms because she was concerned about her license. And yes, if she was actively in a state of psychosis, she would not be able to practice. But as long as that was able to be stabilized, it's nothing to my knowledge. So a nurse would have to comment. I know as a psychologist, because I know individuals in general that as a therapist, they've had their own mental health crisis and had to receive help and support. And while they were receiving treatment, they did not see clients. Once they were stable, they were able to return to seeing clients. And so nurses, doctors, they all get to go to nurses and doctors and all those things. Is there a way to facilitate the patient to come to the facility if they don't have transportation? So, and I don't know that that was the case in Lindsay's situation. I know in Virginia, Medicaid offers transportation. But transportation often has to be reserved at least a week in advance. And in my area, the transportation, so my client might be able to schedule transportation, but sometimes they're picked up too late for their appointment. Sometimes there can be issues with transportation. Um, are telehealth sessions conducted via phone or Zoom? So most providers require video and audio, so concurrent. So Zoom isn't secure unless the therapist has a secure Zoom account, because there are secure Zooms available. But I personally use doxy.me because that one is free. So I don't pay for that one. If there are any therapists out there looking for a free like if they need a telehealth option. And then the I'm laughing a little because I just got a bag from Simple Practice today. This is not sponsored. I get absolutely nothing for sharing this. I went up to DC earlier today to hang out with a friend. The APA conference is happening, and I just so happened to run into the Simple Practice people. And that's my personal EHR. There's also therapy notes. There are a ton of other electronic health records, but my electronic health record offers a secure way to provide telehealth therapy to clients. Okay. Um, are there any ways to facilitate the patient to come to a facility if they don't have transportation? All right, so we got that. So why did Dr. Tufts continue to do telehealth? So that would be a question for Dr. Tufts, and I am looking forward to cross-examination. I really am looking forward to cross-examination. And also, I don't think things started to deteriorate until toward the end. So I personally, and I don't know if any policies would change with that facility, but after someone is hospitalized, and so I work for myself, I don't work for an agency or like a larger company, but it's been my policy that after a client is hospitalized, I have to see them in person, or I have to work to transfer their care to a therapist that is in person. So Anthem, we're talking about behavior, Anthem Blue Cross Blue Shield in Virginia for commercial Anthem. They actually offer intensive in-home therapy for children and adolescents with severe mental health issues. So if a child or adolescent is in and out of psychiatric hospitals, if they are struggling with severe mental illness, Anthem Blue Cross Blue Shield is the only commercial insurance that I'm aware of in Virginia that pays for that service. Do you speak to hospital care teams for your patients? So only when the patient agrees to that. So I'm always provided with the discharge summary. So hospitals, they will automatically get a release for the treating providers, because if it is an active client of mine and if they are hospitalized and discharged, I normally receive a discharge summary. Have there been clients that have been discharged and I wasn't aware that they were in the hospital and that they were discharged? Yes. So sometimes things fall through the cracks. So a client comes in and they're like, "Oh yeah, I was hospitalized and I had no clue that they were." If I was meeting with them virtually, I would then ask for our next session to be in person. That is, I think, one of the better ways, because it's hard. So the reason why I do that, so the reason why I say meeting in person, because for telehealth, you can only see from here up, or depending on how the client has their camera. Because I've had some clients that they're like, okay, I'm going to play with the camera a little. So depending on how the client has their camera, I can't see their foot like shaking. I can't see tremors. And now so I don't know what Dr. Tufts did for, because some individuals will provide, like, I need to see from your waist up, or like situate the camera so I can see, your entire body. That's rare. I've never heard of somebody in a telehealth session being asked to like put their entire body in frame, unless they're doing a remote psychological evaluation. I personally am not a fan of remote or like telehealth psychological evaluations. I prefer in person, but that's my own personal preference. I will do a virtual intake. So that's our initial appointment. But for psychological testing, I have to see you in my office. I get a different feel for people in the office. When she expressed she was numb and disconnected from her baby, wouldn't that cause concern? And so I think they were trying to treat that and they were recommending outpatient therapy. So yes, I do think that would, and I think they asked, are you feeling like hurting yourself? Are you feeling like hurting your child? And the answer was no. They assessed for psychosis. And at that time, the answer they were provided was no. And so it's really easy to Monday morning quarterback this. Okay. Because I've heard of situations where something tragic has happened after after somebody was virtual and then in person was recommended. I've heard of horrific things sometimes happening if individuals don't always follow up with care. Um, but sometimes not every case should be telehealth. And I think it's good because sometimes the client has to know that. I also wonder if, because Lindsay was a nurse, so I know as a therapist myself, so I'm a psychologist and I have had three different therapists in my life, one in person, one 100%. Oh, and then the other two, no. So two in person, one virtual. Okay. I'll say that again. In my life, I've had three outpatient therapists, two were in person, one was virtual. I've worked with psychologists. So I worked with two psychologists and one master's level therapist, because master's level therapists, so they are just as good at therapy as a psychologist, like they can be. So it depends on what type of training, what type of interventions a person is trained in. But psychologists don't receive more training in therapy than a licensed clinical social worker or a licensed mental health counselor. So when somebody is looking for outpatient therapy, they don't necessarily have to go to psychologists. Often people want to go to a psychologist. So for my clients that I see for outpatient therapy, I don't diagnose them with, like, if I have concerns about mood disorders, like if I have an outpatient client and I'm concerned that they might have bipolar disorder or something, I will refer them for a psychological evaluation. Even though I could diagnose it myself, there's some things, because there's so much stigma attached to certain diagnoses, I often recommend a psychological evaluation prior to things like schizophrenia, things like there are certain diagnoses that I just won't give unless there's a history, or unless it's clearly, like, if I had somebody arrive in my office that was actively psychotic, or yeah, like, okay, I might be able to narrow things down, but that would be rare. All right. So, what do you make of the difference in account from the civil filings? I know, describing symptoms, and what was reported and documented at the time. So the civil filing was written by an attorney whose goal was to focus on how any, like, if the doctor didn't follow a standard of care. That's my understanding. That's my understanding with the malpractice lawsuits, is if there was any concern about anything that fell through the cracks. But of course, the client's attorney is not going to say, oh, well, the client sought out a different provider for a different type of service. And um, so it's going to be focused from one end, and often the doctor is not going to publicly release their response. If people find, like, if for some reason it's a public filing and people find it, I don't know if the malpractice lawsuit was submitted um also so that the narrative and things would change before. And I don't I'm just we're just talking, okay, we're just talking. But if the narrative would change around the legal case, I don't know. I have questions. I have more questions than answers. I'm late. Do you think Lindsay maybe didn't connect with Dr. Tufts because she didn't have confidence? So uh I'm interested to hear what the individuals that assess Lindsay Clancy after the fact. I am interested to hear what they have to say. Thank you all for the jewels. I think this is the first time. I don't know that I've received jewels before, but thank you all for the jewels. I appreciate you all for all of that. All right. All righty. I'm trying to make, there we go. All right. I like this new system. It is fun. Thank you all for the questions. So this question is: wasn't she taken off the Seroquel too quickly? If you remember, she was tapered down on the Seroquel in the psychiatric hospital. So something interesting I thought from the testimony, and y'all let me know what you think of this in the chat. I thought it was interesting that she slept better when she was in the psychiatric hospital than she did when she was at home. I have rarely had a client say that they got better sleep in the psychiatric hospital than they did when they were at home. If I was on that jury, and it's not that that would change my opinion about anything, but that just made me go, hmm, I don't, that was interesting to me, because often psychiatric units, they tend to be kind of loud at night sometimes. There's a staff member checking on you every 15 minutes. Somebody is like keeping eyes on you. You often have to sleep with the door open. There's no privacy. yes, you might have your own room, but you're normally on like a unit with other individuals that are also in a mental health crisis. I have rarely heard of people. Has it ever happened? Yes. But I more often hear people struggling with sleep in inpatient than getting better sleep in inpatient than they did at home. So they started coming down off the Seroquel while she was in the psychiatric hospital. Would you um, suggest patients do yoga, meditation, breath work? Yes. I thought it was interesting that Dr. Tufts recommended fish oil and other natural options. I wasn't aware of that. I wasn't aware that when Lindsay was kind of on the fence about different medications. So after she had that initial negative reaction to Zoloft, this is how I'm remembering the testimony. Before starting Buspar, I thought that Dr. Tufts talked about natural options because physical activity, what a person is eating, sleep is all very important. And during Dr. Tufts' testimony, because I was thinking they were just switching from medication to medication to medication, I was thinking that they weren't taking a break in between. But there were like there were some breaks between medications that I wasn't aware of. And so I thought that was interesting. Um, I wonder if in the future, so there might be some psychiatrists that might refuse to see somebody if they're trying to see multiple different psychiatrists at the same time. Because it sounds like Lindsay was going to Dr. Tufts and she was also being seen by another psychiatrist at the same time. I need to hear about those records because I need to know like, okay, so this doctor was prescribing this and saying this. I want to know what Lindsay was telling that doctor. I thought Patrick talked to one of the doctors because a lot of people are mad at Patrick. Oh, a lot of people. I've heard of that out there theory about did Patrick really do all of this? I do not think that's true at all. They have him on video at CVS. They have him picking up the other thing. I honestly, I don't think um, he had anything to do with this. I think he trusted Lindsay that because there were points when she was telling him that her thoughts were getting dark. I don't know that she ever said it was psychosis. So there's a difference between intrusive thoughts and psychosis. So an intrusive thought is like a thought that you don't want. So I'm going on a trip tomorrow. And if I have travel anxiety, so this isn't something that I struggle with, there might be some people that might have intrusive thoughts about something bad happening on their way to on their way for their trip. So that can be that's a thought I don't want. It is a distressing thought. It's not a thought that I feel like comes from inside of me. It's like this external anxious anxiety thought. If you've seen the movie Inside Out 2, ooh, I'm gonna grab her real quick. Mm. Let's do a little psychoeducation about anxiety. So, we are psych nerds here where we nerd out about psychology. Anxiety, it is a normal, natural emotion. But what it does is it hijacks your amygdala, your fight, flight, freeze, people please part of the brain. And sometimes what can happen is a person can start to have very scattered, random thoughts. If you're listening to anxiety, because anxiety will be like, what if this? What if that? Things are never going to, like, anxiety can really have you spinning and having all kinds of thoughts. There are ways to talk back to that anxiety. And that's where I do agree with Dr. Tufts that therapy and medication is often, and I have some clients with severe with anxiety that they're able to manage with mostly therapy, and then sometimes they have something for if they have panic attacks or if the anxiety gets really bad. But you have to learn to talk back to the anxiety and realize that the anxiety is not you. Because I'll have some people that say, I don't like being around people, but really it's their anxiety doesn't like being around people. They actually like going to concerts. They like being, but they just don't like feeling anxious. And anxiety wants certainty and control. And I'm just saying this in general to provide general education about anxiety, because my goal is always what can we learn from this case? What can we do? I saw many theorizing postpartum psychosis. What are your thoughts on that? Was it related to pregnancy or only a larger mental health issue? So that's where sometimes if somebody is having mental health symptoms the year after birth, many will consider that to be a part of the postpartum period of time. I'm waiting to hear testimony about the psychosis because I've heard intrusive thoughts. It's my understanding that after the incident that Lindsay said that she heard a male voice telling her to do it. But from everything I've heard, and I could have missed something, I have not heard, because even Patrick's testimony was she talked about intrusive thoughts, dark thoughts. She mentioned having thoughts of harming the children. He was aware of that, but he didn't think she was psychotic based on what I heard him say. Based on what I heard him say. All right. All right. Hey buddy, what's going on? Time. Okay, so I need about I need so you want to go play your Switch? Okay. So I can't do it right now this moment. Dada will be back from Five Guys in just a little bit. Okay. All right. I just need like 20 minutes. Okay. But so you can go get a snack. You have lots of choices. And so that's why I asked you to talk to daddy about disabling it earlier. And did he do it or he didn't do it? Thank y'all for letting me parent. Okay. Okay. So daddy and I will talk about it. Okay. Right now, your options are you can play your Switch, you can go watch TV. I just need like 20 minutes. All right. Okay. Good job. I'm proud of you. Please let it be 20 minutes. Okay. So go set an Alexa timer for 20 minutes. Okay. Or come back up and tell me when it's 5:24. I need to be saying be kind, don't do crimes. Okay. And I'll see you on, I'm not getting off yet. Okay. 5:24. All right. So do you agree with how Dr. Tufts prescribed the medications? Why did she keep trying SSRIs? It seemed like a huge red flag when she reported not sleeping. So it's my understanding. So based on Dr. Tufts' testimony, it's my understanding that Lindsay had been on Prozac in the past in nursing school. And it would be so normally, if somebody has bipolar disorder, because normally the symptoms emerge in before like 25, normally, not always. So is it possible that something could have emerged later? I guess it's possible. But the fact that she did supposedly took the medication in the past and did okay on it, the difficulty with sleep, I don't know that Dr. Tufts noted that it was 2 days with no sleep. And then also with a manic episode, they're not sleeping, but they're okay with it. Okay. So she seemed distressed about not getting enough sleep and tired and feeling so that could be more of an anxiety, depression, and just a low mood, because difficulty with sleep can be a part of multiple different diagnoses. And that low dose of the medication, so remember, I'm not a psychiatrist. Okay, I'm not a psychiatrist. But if the person starts having rapid speech, if they start saying I all of a sudden I cleaned the entire house for 3 days and I didn't sleep, like, so mania or hypomania, it looks very different. And based on Dr. Tufts' testimony, she did not believe that Lindsay was having signs or symptoms of bipolar disorder. That was based on Dr. Tufts' testimony. Okay. So based on Dr. Tufts' testimony, I didn't have like what she said. I've had clients have similar experiences with different medications. And there were times when it seemed like Lindsay was adjusting the medications herself and not necessarily because what Dr. Tuff said is Lindsay said she tried the Remeron with the Ativan, or like, and I'm making up things because I don't remember exactly what the combinations were, that she tried this combination and it was helpful, but she tried this combination and it wasn't helpful. And so it seemed like Lindsay was also kind of adjusting the medication, trying to get some sleep, trying to get something that could work. Okay. Was what was the trigger that led to her to do this? So that's where I don't know that we'll ever know what that was. In general, from what I've heard, it sounds like she might have been hopeless about if she was ever going to get better, if she was ever going to um feel better, if she was ever going to feel like get out of that dark place that she was. That was based on what I've heard so far. Yay. Your comments are so reassuring. The psychological blood testing and sleeping better away from home comments were, yeah, I was the sleeping better away from home. So I personally was wondering if that was because she wasn't with the children. She didn't have to be a mom. So being a mom is exhausting. I truly believe in airports, the reason why they say if there's an emergency and the mask fall, put your mask on first, it's for moms. Because we'd be over here passed out trying to make sure our kids have their mask and we don't have our mask on first. So as a mom, I have to put my mask on first. I just got back from DC. So I live close to DC. So I was able to take the metro in. I met up with a friend for brunch. That's when I stopped by and got to hang out with some different people. That was something I did for me. Okay. Uh, Me, my mom, and my son, we're about to go on an adventure in like starting like tomorrow. I'm super excited. That is me taking care of my mental health too. And it's important to take care of you. And it's important to have safe spaces where people can talk about like, hey, sometimes it's difficult being a parent. I want to talk about the Facebook post because the state read the Facebook post where Lindsay was talking about having difficulty and just some of her thoughts about being a mom and parenting. And this was specifically an attachment focused parenting group. And I wondered why the state would bring that up. And then I remembered that the nanny talked about not having difficulty getting the baby to take a bottle. And so I wonder if somewhere the state is thinking that like there was this growing animosity and resentment toward the children, but everybody described her as a loving mother. So I need more information. I really need more information. I have not made a decision on this case. How is it possible she sees two psychiatrists at the same time? Wouldn't insurance ding that? No, they didn't. They didn't. So insurance paid for both because one was a different program and she wasn't seeing them the same day. So a person could. Now, I don't recommend this. I don't recommend that you have two different psychiatrists managing your mental health medication. Sometimes a gynecologist will address postpartum symptoms. I've had clients that their gynecologist started them as long as it doesn't get to the place of like severe like thoughts of harming themselves or anybody else, as long as it's just kind of typical, but more than baby blues, and it's just postpartum depression, as long as it doesn't get too severe. I've had clients be able, their OBGYN has managed some of that. I thought it was interesting. So the reason why they started her on the Zoloft was so that she would be able to continue nursing. There are some medications, this is just general information, that Dr. Tufts, the psychiatrist, talked about on the stand. There are medications that are safe to use during nursing. And then there are other medications that you can't use. So like if the mother is taking the medication, the child would have to be on formula that the mother would have to stop nursing. The fed, you want to make sure you feed the baby. So however you feed the baby, make sure that you feed the baby. All right. Did Dr. Tufts recognize this as postpartum psychosis though? So there was Dr. Tufts did not see psychosis. So there were no signs or symptoms of psychosis observed or documented by Dr. Tufts. All right. And then if Patrick Clancy had called and said, I'm concerned about my wife, she's reporting thoughts to herself and the child, the psychiatrist wouldn't be able to give him information. They would have to follow up with the patient unless they had an active release but if it's an immediate crisis, they would often recommend go to the nearest ER to get an assessment. Um, but it's hard to collaborate care for adults because often it's viewed individually. It's not viewed as a collective, and that's where I think Lindsay was considered for a program, and I don't know if the defense is going to call this program because she was determined to not be appropriate for a particular program. And because sometimes there's some programs that hospitalize the family where like the whole family goes and stays, and they're able to observe the mother with the children. They're able to adjust medication. They're able to kind of treat the family's able to do family therapy. They kind of, it's more of like a holistic, well-rounded thing. I don't know that that's exactly what that program was going to do, but she attempted to do a program and was not accepted to that particular program. All right. All righty. So thank you all for the jewels. All right. Well, okay. Yep. All right. So, and then some things happen, and does it reach a clinical level? So there are lots of things that can happen. Wouldn't admitting psychosis or that cause non-treatment delay for returning to work? So she already wasn't returning to work. Remember, the nanny was let go in, was it November? The nanny was let go because they determined that she wasn't going to return to work. And so, yes, if a person is actively unsafe for that period of time, but that would be job protected leave. They would be able to get FMLA if they're full time. I think she was a contract worker. People have mentioned that before, but they did mention that Dr. Tufts did paperwork with her and did a return to work letter. And then later, I think she wasn't able to return to work. And so, yeah. All right. Yes, we're nerding out here. I love it. Let me know if y'all have any general questions. Make sure to like the video. If you are new to my channel, I'm Dr. Barry. I'm a licensed psychologist. I'm not your psychologist. And Psychology Today can be like a decent resource. Like, so when somebody is looking for a therapist, because it's just a directory where you can sort it by your issue, you can sort it. Let me see if Psychology Today has postpartum listed. We're going to check it out. All right. So I'm going to share my screen, and we are going to take a journey over to Psychology Today, because I will show you all how I search for resources. So it's psychologytoday.com. Not every therapist is listed on it. My internet is taking a second to load it. Hopefully the internet is fine. I am hardwired in. Oy. She's taken forever to load. There we go. All right. So then you can search by your area. So I'm going to do Fredericksburg, Virginia, and I'm looking for therapists. You can also search for psychiatrists, treatment centers, or support groups. That took it away. Fredericksburg. All right. So then we press search, and this is going very slow. I'm getting the questions together. While we wait on this, I'm taking a look at y'all's questions. Make sure to put QQQ or a question mark, 3 question marks in front of your question. That just helps me see it. I did think the inpatient stay, the doctor clarified that yes, Lindsay did receive treatment during that inpatient stay, that she was seen every day, received multiple services, and they clarified what they saw. All right. All right. So I'm going to go ahead and answer this one. What about the mania after the second birth? Is there such thing as postpartum bipolar? No, I don't think so. I've never heard. Um, if because I've heard of postpartum depression, postpartum anxiety, that type of mood instability. I've never heard of postpartum bipolar. I actually know Thomas, Eureka. So, resident in counseling is an individual, and I'm not picking on any of these people. So, this is just in general, we're just scrolling. So, a pre licensed person might have their degree, but they're under supervision. And so, licensed professional counselor in my state, LPC, LCSW. So, clinical social worker. I don't know. Google must have. Um, and then you can sort it by, you can filter by if I'm looking for a female, if I'm looking for specialties. This is going really slow. PMDD is on here. Postpartum depression is on there. All right. So you can sort it by different things. I'm just going to close this. It's going incredibly slow. All right. All right. So let me go ahead and answer some of the questions that I've highlighted. Do you think Lindsay became a bit dependent on the Ativan and the Valium because they provided quick relief from her anxiety? I think she really needed to focus on therapy. I would have liked her to have more therapy. So taking Ativan or Valium every day as prescribed can build up a dependence. So that's why the doctor mentioned having to withdraw from those medications. And that's why the doctor was trying to do something more like hydroxyzine, some different type of medication that could be helpful for the anxiety in the moment that wouldn't have the same risk of potential addiction or like withdrawal symptoms when a person comes off of it. Remember, I am a psychologist providing you general information. This is not medical advice or any of those things. Okay. So afterwards, did her postpartum depression suddenly vanish? That's one of the things not making me believe it's postpartum or postpartum depression. So I know it's completely normal to ask to talk to a lawyer. Her lack of emotional response to finding out about the death of the children, and there might be something that we don't know. So we don't know what her like, because the fact that she didn't ask about the children or any of those things, that just has me pausing. I don't know. And I've talked a little bit about sometimes the brain will try to protect people from information that people just can't tolerate or handle. I know that when the friend went to visit her after the crime in the hospital, they really couldn't talk about the children, but Lindsay was asking her friend about her children, which is okay. So I have known people that have lost children, and for years after, it pained them to see another child. It pained them to like see pictures of other. And I'm not saying that she wasn't in pain. It's just some of this is just, I don't know. Some of this is a little weird for me personally, but we're just all watching together. Do you think the fact that Dr. Tufts is being sued affected her testimony at all? I think she stuck to the facts. So she's not giving an opinion. She stuck to the facts. She was subpoenaed to be there, and she's testifying to her record. And often, so my electronic record, it says when it was signed and the last time it was edited. So if anything was edited after the crime, I would have like questions like, wait a minute, it says here in May of, or after this lawsuit was filed, you went back and you edited this note or something. If there is some type of electronic file, sometimes there's a record of when records are like signed electronically. So like when I lock my notes, I can't edit them again. And if I go to unlock it, I have to enter a reason why I'm unlocking the note, and it'll update the last signed date. And there will be it'll be documented that I edited the note. And so I don't know. We'll see. We'll see. We'll see. Um and so I will say some people can overeat or binge eat in manic episodes too. So mental health is it's all over the place. Yes. So there are certain blood tests that people can do. I personally, I've never had one done for myself. I have had clients that have, they've been struggling finding the right medications for themselves. And so they've done testing through their doctor because sometimes insurance will pay for it. Sometimes insurance doesn't pay for it. And it can depend on the person's insurance. Now, the testing, it won't say, yes, you'll definitely do well on this medication. What it does is it says, based on your genetics, based on all this, I'd stay away from these medications. If you're needing an antidepressant, this is the recommendation. If you're needing a mood stabilizer or antipsychotic, it's this. And then please also remember that mood stabilizers can sometimes be used for sleep. And so that's where, because there's been a lot of talk, like she's being prescribed an antipsychotic. But I've worked with clients that were on Seroquel, Lamictal, some of those different, I think Lamictal is an antipsychotic. Y'all know I'm not a psychiatrist. I know, what is it? There's one, it's a popular one, because that's when clients have to get their blood levels checked. Lithium. So we haven't talked about lithium a lot. Lithium is a medication that's often prescribed for bipolar disorder, and that is one where you have to make sure the levels are therapeutic. So if I have a client that's prescribed lithium, and if the doctor hasn't done a blood draw in the last 3 to 6 months, I'll often ask my client to request, because if the levels aren't therapeutic, they're not going to get the mood stabilizing benefits. Everybody's body processes medication different. So if my husband takes half a Benadryl, he's like knocked out. I can take Benadryl and drive. Like Benadryl, it doesn't make me sleepy. Um, it just doesn't. Some people are more sensitive to medications than other people. The doctor also did a good job describing how certain medications metabolize in the system. There's something called half-life, and that's the time it takes a medication to get in and out the system. And most of, like, antidepressants, mood stabilizers, all of those medications, they take sometimes 1 to 2 to 3 months to get in your system, and they take time to get out. Once somebody is on the correct medication, it's then getting them to a dose that's therapeutic for them. And so, yeah. And so you keep doing that unk alert. All right. Thank you for the jewels. Yes. All right. Y'all are phenomenal. A clapping seal. YouTube has all types of things now. Jules, thank you. Uh yeah. So, but the lawsuit is going to explain, so I need this to come into court. So, I have seen the way that Patrick Clancy's lawsuit describes the bipolar disorder, and that they have different thoughts about things. Um we will see. So, if somebody met with her and has diagnosed her with bipolar disorder and talks about the signs and symptoms she had, goes over all those things, we haven't had that testimony yet, which doesn't mean it's not coming. We just haven't heard it yet. And bipolar disorder wouldn't be about postpartum, because there's a psychosis that can happen with bipolar disorder. So that's where I feel like the defense, I'm like, because sometimes they say the SSRIs triggered mania, and that's why she couldn't sleep. And then that induced the psychosis. But sometimes with bipolar disorder, there can be severe symptoms that include psychosis. And so, was it the medication? Was it not? This will be really, really hard to figure out. Okay. And that's where being regularly monitored, not only by psychiatry, but also outpatient therapy can be really helpful. How should a mental health provider deal with a patient who seems to be frantically seeking multiple solutions, providers, and getting multiple prescriptions for mental health? And so that's where sometimes the doctor will look at, like, if they have, but um so I don't know how psychiatrists handle that. So I won't say that from the psychiatry perspective. I, as an outpatient therapist, I've sometimes had clients do partial hospitalization programs that were Monday through Friday. And while they're in partial hospitalization, we pause my services. So we pause outpatient therapy so they can do that program. And then once they're discharged, we restart services. Or if I have a client that's doing partial hospitalization 3 days a week, I'll check with them to see, because sometimes those programs can be intense and they might not want to do like additional outpatient therapy. But I just want to make sure that we're doing something different from what the other provider is doing. You want to try to have coordination and collaboration with providers. But yes. And so, all right. Do you think she was beating herself up as a perfectionist? So I don't know. So that's where I don't know what the state's theory is. I'm still kind of confused with some of that. Um, I haven't seen that. Her friends describe her as a loving mother. Her friends also don't describe seeing her manic or seeming different. And I think the state is getting at that. That her friends seem to think that, yes, she seemed more tired. She seemed toward the end, she seemed like, I'm going to say less put together. That wasn't the words that they used. She might have seemed a little thinner, but none of her friends mentioned noticing like a change in her rate of speech, a change in her cognition. None of her friends mentioned any of that. I mentioned I talked about that earlier. I don't believe it was Patrick at all. I think there's clear evidence that it was Lindsay. All right. Sometimes people will go down these rabbit holes. It was the defense and state; they are both very spicy. This judge is doing a great job managing his courtroom. I've sometimes wondered if some of the things the judge has allowed in, because the defense has objected to how much information and the emotional things that's going in front of the jury. And I don't know if that'll be something that'll be looked at on appeal if if for some reason Lindsay was convicted. As we're watching, I like to sit back and listen to some of those things, because we have seen whole trials get overturned later because of decisions made during that. I would personally like for Dr. Tufts to wear a nice blazer next time. I like professionals to like, so I always do. A part of that is my own, it's not quite imposter syndrome, it's some bias that people have. So when I come to court, if I go to court in a button-up shirt, most people won't assume that I'm the psychologist, because I have testified in family court before, and when Dr. Barry was called, I'm in a suit, so I look good. Okay, when I go to court, best believe I put on my best. Okay, like I look real good. And it is, so sometimes the bailiffs will even look like, oh, Dr. Barry. Okay. Because I've been sitting out there the whole time. I don't know who they thought I might have been or what they thought I might have been there for. But sometimes, so only 4% of psychologists are African American. And so often when I'm in court, people aren't thinking that I'm a licensed psychologist. Dr. Tuff also said she was reluctant to diagnose her because it would stick with her. Yes, because I've had some clients incorrectly diagnosed. So I've had clients incorrectly diagnosed on inpatient units, and we've had to clear up diagnoses later. I've had clients, especially with like psychosis. So I've sometimes had clients where they initially thought it might have been something like schizophrenia or something, and it was really major depression with psychotic features, and it wasn't schizophrenia. And there are some diagnoses that if you get it, it can be harder to get insurance. So sometimes with a bipolar diagnosis or borderline personality disorder diagnoses, there's some diagnoses where it can be difficult for you to find life insurance for yourself with certain diagnoses. And so I like it when people are cautious with diagnosing. Dr. Tufts initially diagnosed her with generalized anxiety disorder and adjustment disorder with depressed mood. Adjustment disorder is a really common, like that's a really common, you came in adjustment disorder for, but you can only bill that diagnosis for about 6 months to a year. Normally 6 months is what I try to do. And then you normally, if somebody still needs treatment, it falls into a different category. Do you think she wasn't abiding by the treatment protocols? Uh, So the doctor seemed, I think the doctor quoted Lindsay at saying that she wasn't following the plan. But also, I like to listen to my clients, and if they're having negative, um, So if I'm taking a medication and it's making me feel worse, I'm going to talk to my doctor about getting off that medication. I don't think that's going against the plan. That's me listening to my body and communicating what's happening to my doctor. Now, if my doctor recommends, because Dr. Tufts recommended, there were multiple people that recommended her not being on the benzos or being on a benzo that had like a longer half-life. Um and eventually the goal being to get off them completely. And so this case is complicated, but I also thought it was interesting that I think Dr. Tufts saw her January 23rd, 2023. And the date of the incident was the 24th. Psychiatrists also sometimes wear white lab coats. So they wear like a button-up shirt under a lab coat, and they can't wear lab coats into court. All right. So y'all heard me promise my child that I would be done at a certain time. Is Daddy home yet, or he's not back yet? He's home. Can you ask him to do it, please? Thank you. Thank you. Uh, my kid needs he can only be on the computer for a certain period of time, and he has to get an adult's permission to be on longer. And so dad is home, so hopefully dad will do that. Do you think Lindsay Clancy is responsible then if she was seeing more providers? But I think she was trying to see a perinatal specialist, but she wasn't just keeping her care there. She was still going back to Dr. Tufts. And I have more questions than answers with that. And so I need to hear the other record from the other provider before I say for sure. I think it might have been easier for Lindsay to schedule appointments with Dr. Tufts because I think she did that on her own. Like I think there was a patient portal where Lindsay could just schedule an appointment on her own. Because if you remember, because there were periods of time where she didn't see Dr. Tufts, because after the hospitalization in early January, she saw Dr. Tufts after that. But I want to know when the other appointments were with with the other psychiatrist. I have questions. I have more questions than answers with this case. Can he do it? He's about to eat. He can't do it. Okay. Okay. So he can't do it. Um. Okay. So I'm gonna start wrapping up the final questions. Just 6 more minutes. Okay. Promise. Six more minutes. Okay. All right. I promised. Okay. So my thoughts on behavior of being able to appear normal on the phone with Patrick. Does that make sense with the manic episode? Oh, so that I have more questions than answers. So if a person, I would have hoped that would have snapped her out of it to stop what was happening, and it didn't, or to call for help, or to do something, and it didn't. So those are my questions. Did you catch that she was on Prozac in college? I talked about that. I think I'm behind on the chat. And so my kiddo, I promised my kiddo that I would be off in a certain amount of time. So if I did not get to your question, please place your question over in the regular comment section of the video. My kiddo has been very patient with me. I have went almost 10 minutes over the amount of time that I said that I would do. Um, uh, there are lots of medications that can help with. So I have lots of clients that are on all the medications that Lindsay was on. I've had a client that was prescribed one of those medications. Welcome to the membership. I have a new member. I know you don't care. So I need to hear from the defense before I would say how I would vote. So I do not have a statement about that right now. So she also could have scheduled an appointment with the therapist that she already had. Dr. Tufts was just giving that as something additional. All right. I have to go. I thank you all for being here. If I didn't get to your question, like I said, please put it over in the regular comment sections. I do I do provide uh I do hold on. I do provide I hope y'all can hear my unofficial co-host. I do provide short videos sometimes in response to y'all's questions. This case is very difficult. If you are new to my channel, I have multiple other videos that are all linked in this one where I have talked about some of the things that have been asked. I want to make sure that I got to all the super chats. Because Langston super chats. Ooh, 9.99 super chat. Thank you so much. Thank you for the stream. My kid is he's at the end of his patience. And so I so appreciate you all. Be kind, don't do crimes, and I will see you all next time. Whew. Next week, I'm going to be on vacation, but I will, when I come back, I will definitely be streaming that following Tuesday. So, not this coming week, but the Tuesday after will be my next live stream. I might do something on Sunday. We'll see. So, just keep your eyes open if I do anything. Okay. I appreciate you all. Be kind, don't do crimes, and I will see you all next time. Have a good one. Bye.